Good afternoon, everyone. I'd like to talk about my upcoming research study with NFORC on managing facial lacerations in children. These are common and can be very challenging to treat, as the child is often upset and in pain, and the parents are very distressed and want the best outcome for their children. There are several methods of treating facial lacerations. However, there is no consensus on what is the ideal treatment. Here are some of the commonly used methods at present. For the more superficial wound, we can use medical surgical glue or adhesive tapes, but for the deeper wound, stitches provide a more accurate result with the best long-term cosmetic outcome. This is a 3-year-old boy who was sitting on the front seat of a car with his seatbelt on when his gran, who was driving, lost control and the car rolled over. He was concussed and the windscreen shattered, leaving him with a nasty forehead laceration with bits of glass embedded in the wound, which you can see up here on the CT scan. He had to have a general anesthetic to have his laceration fixed and all the glass bits removed from his wound. The ragged laceration was stitched using soluble stitches in this case, and here's the result just 2 weeks after the operation. We expect further improvement to occur. Poorly treated facial lacerations can lead to serious complications which can be permanently disfiguring for a child. Here are a few examples. This is a widened scar. This is what we call as a heaped up keloid scar. And this little boy, unfortunately, developed a wound infection, which is going to heal with even more scarring than normal. So my research project with NFORC is to see if we can find the ideal treatment for these children in order to provide good cosmetic results, but with as little stress as possible. So we are going to compare using a non-dissolving stitch against a dissolving stitch to fix these cuts on children. The non-dissolving stitch needs to be removed in 5 days, and children who are young and uncooperative need sedation or sometimes, worse still, even a second general anesthetic procedure to have these stitches removed. The dissolving stitches, on the other hand, do not require a second procedure, but we are yet to prove if they are as good as, or maybe even better, than the more commonly used non-dissolving stitch. So this research study with NFORC will hopefully help us answer these questions with a view to providing national guidance on how they are best managed. Thank you very much.
Children's scars are worrying to parents, children, anybody who's around, and it's important to treat them well, with as little pain as possible, and that's why this research is going to be so important. It may seem so simple, and that's what a lot of this research is about. It may seem very simple, but it's research that hasn't been done yet and needs to be done.
This is absolutely brilliant, creating the world's first ever research centre dedicated to this most socially sensitive part of our body, which will collect major data and organize research to improve patient treatment worldwide. Well done, Saving Faces.